All right.
Perfect. Okay. I'll just start jumping through here. So, hi everybody. Thanks for joining again, Improvement Academy. We're on session 4 of 12. Today we'll be talking about project charter development and measurement. We're starting to really outline our project, put it in writing, etching into stone, and of course, there's always room for kind of finessing and wiggle room, but certainly we are starting to write things down to then share with others. Again, my name is Roberto Vargas, Director of Safety and Performance Improvement at Contra Costa Regional Medical Center and Health Centers. Okay, so what are we doing today? First step, we're going to do a little review of the last session, session 3. We'll show, share a little bit more about what is this topic, project charter, what's the significance of it as it relates towards improvement. We'll walk through the steps of designing a project charter, and then there is a component of it about measures. And so we'll be talking about the specific measures that are involved with performance improvement projects, and then how you might apply this to your real life situations. Okay, and projects and improvement. Okay, so first part is that be kind, please rewind. And so just a quick review here. We have now gone through the gauntlet of two big representatives of PI in the PI space. You have IHI, Institute for Healthcare Improvement. You have Toyota Production System that then translated into the Lean Management System. And here are some of the large tools or large methods that we had kind of learned through. One is understanding the lean methodology in the top left corner here, as far as its flow, so identifying value, map the value stream, create flow, establish pool, and seek perfection. If you're following those steps, at least to that methodology, you're making improvement happen. Then flowing to the right here, we'll do in a clockwise fashion. There's a waste wheel, and that showcases the different wastes that you can help to identify maybe during the course of your project that might lead towards identifying deficiencies, otherwise said as opportunities for improvement. So defects, what defects exist, inappropriate motions of people, of objects, maybe there's overproduction of something, maybe there's too much processing or inventory of something, and each of those things can contribute towards a not so efficient environment that may be causing hindrance to actual good workflow. Then keep going to your right, you can see a little map here that showcases IHI's model for improvement. And there's 3 questions associated with this one. What are we trying to accomplish? How will we know that a change is an improvement? What change can we make that will result in improvement? And as you flow through those questions, you're conducting a test. And that test of change, I'll say it differently, test of change is known as a PDSA, Plan, Do, Study, Act. And as you know, in previous sessions, I always liken a lot of this content to think about the scientific method, and you're thinking through, well, how do I get from A to B to C? And the PDSA cycle is kind of mirrors that, right? I'm planning a study, I'm doing the study, I'm now studying the study, so I'm actually seeing the results of it, and then based upon the results, I'm now figuring out what do I want to do with that information. Did the study go as my hypothesis has stated, right? And there's some 3 A's that I like to speak to. You're adapting, you're adopting, you're abandoning your decision. So there's a decision point. Am I going to adapt the outcome to adjust it a little bit? Am I going to wholesale? Whoa, I love what resulted from the study was exactly what I hypothesized, and now I'm going to maybe continue testing to ensure that there is validity to these tests. And once that's done, I'm going to wholesale adopt it and start moving forward with potentially spreading down the road. Or, oh my goodness, this wasn't what I intended. I'm learning with my team that we actually maybe tested the wrong thing with the wrong people, and we need to full scale abandon. and it's a hard pill to swallow that maybe you just invested some time and time in everybody's kind of schedule, but you have to make those hard decisions sometimes. Again, flowing through, we've talked about SMART goals, and we talked about how this acronym can help you to identify what are the needed components of making a really nice goal. Is it specific? Is it measurable? Is it achievable, relevant, and time-based? If those components are built into your goal, you should be on a good track to be able to move forward and saying, okay, us as a team, of course, contributed towards the write-up of this goal, and we have a good idea of what is needed and by when. And then last, we've talked about this at length, the different components of really the background of all of this work, and it's layered of do we appreciate a system? Do we appreciate the psychology behind improvement, as well as how are we working together as a team? Do we appreciate the knowledge that's needed to be able to make improvement happen? And then can we also appreciate the variation in data? If we can appreciate each of those things, that's the foundational component of PI, and us right here working together, us becoming improvement advisors, us improvement champions. If we can appreciate each of those components, we are doing a good job with really appreciating how to move things forward. And then there's various models attached to each of those big layers, those big buckets. Okay. All right. And I had shared about, there are various frameworks to talk through. I'm suggesting let's kind of get all on the same page real quick and kind of simplify. Let's talk about, just so that we can have some common language. I certainly appreciate and I want to make sure that everyone's kind of aware of different stakeholders in performance improvement and where they're coming from and their different models. And I also want to make sure that I'm kind of saying, hey, let's just make sure we have a similar language to talk through. So I'm going to be talking through this framework, which, as you can see, mirrors a lot of the other frameworks that we just talked about. You're assessing something, you're identifying the core baseline of what's happening, you're testing, you're potentially spreading if you like what you had tested, and then you're building in sustainability. And you can kind of flip-flop back and forth between spread and sustain, depending on at what scale you're at in your project. If you're sustaining just maybe the very beginning part of a first layer of a project versus, well, I made something good happen in this one maybe clinic and I want to spread it to another clinic. So now I need to spread it, but then overall I need to sustain what's happening amongst all clinics or at an individual clinic. So those can kind of flip-flop depending on where you're at. But you can see here some of the key questions that we're talking about at each of these layers. And you see that they also mirror what the IHI's model for improvement shares. So just putting out there, I'll be continuing with talking through this framework as we move forward. And again, layering on, this is just taking that same framework and continuing to layer on. So on top of those questions, we're going to be learning about various tools. And there's various tools that are good for certain pieces of the framework. And really, here's a number of them. I may add, I may take away, but I wanted to showcase a number of tools that are good to learn, and we'll be touching many of these tools along this session, and that kind of brings me to the very beginning here with what is being highlighted. So we're right now in this assess phase. We are asking ourselves, what are we trying to accomplish? And in this phase of the performance improvement, we have a few to-dos to move things forward. We need to do some project planning. We need to make ourselves put together in writing what exactly are we planning, and that's known as a project charter. And then there's other documents that we could potentially use that A3, if needed. There's a voice of a customer, there's value stream mapping, there's process maps, there's data collection needed. And there is a kind of please don't treat this as a hard fine line. A lot of these tools are can be fluid and move from one phase to the other, and kind of vice versa, depending on where you're at, because it's all about what the problem you're trying to investigate. And sometimes there might be little nuances in there, or there might be little nuances on even what information or direction you're receiving. And you're saying, well, someone may ask you, what's going on in this process? And you may say, whoa, I'm not even exactly sure what's the problem to begin with. And there's no too much about harm or foul, with mix matching. So if you want to start with a process map, you can, and that may help with identifying future goals, right? It may help to identify additional stakeholders. And that also speaks to the fluidity of what we're going to talk about today with the project charter. But as you'll learn, project charter helps you to write down all of the needed things to move a project forward. And it's meant to be revised. You're supposed to continuously revise it and edit it as you learn and go forward. So please treat this as not hardcore steps. This has to happen at this one stage. Treat this as generally, these are typically what can happen in these phases.
And then, Roberto, if I can just add and build on this, ladies and gents, as you notice, here we have the 5 phases, and like Roberto said, they're fluid, and in other, say, methodologies or approaches, it might be called something different. So what we don't want you to do is get hung up on, it's got to be assess, identify, test, spread, sustain. Those are the key buckets. And in essence, what we're trying to say is kind of like Roberto said in the week session 1, this is like the 3rd grade science project. What are we trying to do? Or if we have a problem based on something, some complaints or some data or something, how does it work now? What's wrong with how does it work right now? And then what can we do differently to fix it? And then how can we test or experiment to make sure that these things that we want to do differently actually work? And then if they work, we would like to spread them and sustain them. So try to keep it like really simple and practical, and think about how it would apply in your own world. And then at the end, Nisha has a big surprise for us that it's going to make everybody's mouths water. But go for it, Roberto. I just want to throw that in there.
Thank you. And I may, again, the luxury of kind of being able to provide this training. I might tweak a few things here and there, so keep you all on your toes, but certainly I'll share along the way if any tweaks. But again, be fluid with what we're sharing here. And I think the main thing is, as you master and understand what we're trying to do, I'm sure it'll start making sense with what tool to use when. Okay. So project charter. What goes into this? So organizes the improvement project, right? That's the big emphasis here. It helps to define the problem. It sets the goal, puts it on paper, documents baseline data, lists resources, lists sponsors and team members. All very, very necessary things to ensure your project gets some traction to move forward with. I'm sure you've all experienced maybe sometimes where we've called them pet projects. There's something that we want to do. We have a really we want to emphasize on, great, we want to make something happen. Or it might be someone else that has shared with us, oh, this thing needs to move forward. But what if there's no sponsoring of that project? What if there's needed resources that you're not actually getting because it wasn't signed off by needed folks who can provide those resources? So some of these foundational things really, really important to help you really blast off and make this project happen. And we'll go through each of these really specific, but giving you a big picture of what we're trying to do here, why it's so important. We are trying to ensure that you have something written in paper that you can share with others, with not only your teammates, but your sponsors or anyone else, to really say, this is what we're trying to achieve. Does everybody agree? All right. So see, I already see a little cutoff there. I'll read it out there. But here's a one version of the project charter. There's many ways of doing this, but there are typically some big pieces here. And again, I'm going to go in detail in each section, but you'll see project name, timing. There's a purpose statement, SMART goal, activities plan, expected benefits, team, product scope in and out, project measurables. Again, I'm going to go through in detail, but in this one stage, I'm giving you the overall what this looks like. It's meant to be a one pager. It's meant to be, I can carry something around with me if I need to go in person. I can put this on a slide deck and share this on a Teams chat, a Zoom, to say, hey, this is what we're doing. This is what we're trying to achieve. This is something I can easily convey and communicate with others quickly. That doesn't require flipping, doesn't require a staple, doesn't require, what if I lose pages? It doesn't require that I need to sit down and read through a booklet. This is meant to be a one pager bringing everybody together. Okay. So again, we're going to go piece by piece. And so first part, project name, and I'm going to give some examples. I think of this as it summarizes the project. There's a clear title that describes what you're trying to achieve. You wanted to engage the audience. And I know this is, here's one example that I had done. I have done this Fit Kit project. Okay, so it's if you know what that one, it's a colorectal cancer screening project. And so fecal immunochemical test kit. Okay, that was my project. And so not only was, I think there was actually more to it, and it was to reduce, so improving Fit Kit rates to improve screening for colorectal cancer. So sorry, I think there was some cutoff there. Timing. There's a timing component here. So you're thinking through, I like to think through three things a part of timing. So when did you first design your charter, right? When is the origin date? When was the charter first written? The second one is the project timeline. What should I expect here? What should I expect you to start in a month, 3 months, 6 months? Are you starting tomorrow? And then when do you anticipate wrapping up? Remember, this is meant to be it can change document, but you're giving the audience a rough estimate of what to expect. And then there's the revision date. Because these are being revised, you want to keep your audience apprised of when was the last time you made some edits? Did you make some edits yesterday? Or is this still the original document that has been unedited? And then that tells me as an audience member, as a person who's reading, okay, gotcha. So there's been no changes since the start of this charter. Yeah. Going next section is about the purpose/problem statement. So this one, think about this section as why are you doing this project to begin with? What is the problem you are addressing? Who is affected? What's the problem? Why does it matter? How does it affect the patient? Okay, there's a lot of really helping the audience to understand why are you doing this project to begin with. And so for me, I wrote a whole piece that, and again, doesn't have to be too lengthy. You can do less than what I wrote, but it's supposed to really help the audience understand why are you doing this. So I said, great. So if patients use this screening methodology, we're hoping that essentially by the way that this test works, it provides for earlier effective screening to be done on colorectal cancer. And I had also written down some things that I had found early on that shared what were the issues that were being brought to my attention initially, or in this initial kind of figuring out why am I even doing this to begin with, and so some of those I had shared was, well, I know that there were some issues with patients deciding to participate in the use of this screening test or not. And I'm really curious to know if there's a misunderstanding with how to actually do this test, and if the instructions themselves were lending towards some of that confusion, and if there was potentially maybe deficiencies in our processing of the specimen, maybe in our lab environment, and what were the reasons or contributing things towards some of those lab process deficiencies. Maybe there wasn't enough patient identifiers. Maybe there was some of the samples that were received had passed a certain time frame and had then become expired, and they were not good for us to process. So these are some of the problems that I had pushed forward. And then the SMART goal. So SMART goal, again, we spoke through that a little earlier, but it's specific, measurable, actionable, relevant, timely. And so I said, okay, so December 31st, 2021, CCRMC and the health plan will improve colorectal cancer screening rates from 50.1 to 53.2 with a stretch goal of 56%. Okay, I'm trying to really share what are we trying to achieve as a big picture. And you'll see this again in future measurement. Okay, then there's a section called activities planned. And you want to think about what are maybe some initial things, again, brainstorming initially what you want to achieve. Maybe it might be some initial activities just to kind of get things going. And you're using some nice words. You're engaging, you're calling, you're developing, you're training, some of those terms I'm just sharing some things to consider as you're thinking about what are different interventions you can put in place to either explore further or help identify additional root causes or potential solutions. So for us, and for me, it was I needed to engage certain stakeholders to potentially redesign the language around notification to patients. I needed to maybe call patients to really help and get the patient's voice to understand why were certain pieces of information that they provide missing. And then again, understanding more and better the different processes that exist along the whole workflow for how to process these specimens. And then the next section is about expected benefits. This is me now thinking about the customer, the voice of the customer. This is me thinking about, well, what if we do this work, what will actually be the benefit, right? So as you kind of heard my spiel with what the problem was, and you can see what's the rationale for us doing this work, I can say, well, we're going to increase cancer screening rates. We want to be able to screen patients earlier as much as possible. And certainly if there is a positive process specimen, then we can go ahead and treat that much more faster, right? This is about life and safety, and you can even include financial investment as well. And then there's we want to increase patient satisfaction with being able to do the right thing easily. We want to increase, I know our physician staff, we understand that physicians often are right there with the patients who are upset, and if they have a specimen that was sent in and maybe it was not processed, maybe it was quote unquote lost in the ether, in the system, and the physician is the one getting the firsthand talk, or maybe the nursing team as well. Where's my results? And so we want to make sure we're helping our clinicians with getting the right results at the right time and whenever they need it. And then increased certainly return on investment, because we're sending out a bunch of kits to be utilized, and that costs money. And we want to make sure we're being good champions of public funds, and we are making sure that we're being efficient, and we're ensuring that we are getting the most out of what we're spending. Okay. All right. Next section is about project in and out of scope. So this one's, I know it can be a little challenging because you may say, what does that mean, scope? Think of that as what is the area or opportunity for improvement? What work are you planning to do? What work are you planning not to do? Which is also really important. And for a team who is maybe multidisciplinary in nature, hierarchical structure, everybody has their own separate roles and responsibilities. And if there's not a clear decision on what needs to be actually worked on or not worked on, you can see how there may be some movement into areas that wasn't intended. And maybe we really wanted to work on the outpatient ambulatory setting. But then all of a sudden we start, because of X, Y, and Z thing, we said, you know what, some of the root causes start branching out into the hospital. And there's in the transition between discharge to ambulatory setting. And that's great to identify, but maybe we're right now hyper focused on just the ambulatory section of things. And because if we were to start deviating, if we start expanding into that other world, we may dilute our overall energy and capability to make good sustainable change happen. So it's really, really important to really put a good kind of quote unquote scope on your project. And it also shares with everybody else, this is what we're doing and this is what we're not doing, especially so there's no missed expectations and interpretations. Because you might also imagine, maybe there's an executive who thought a certain thing was going to happen and then didn't, after you maybe spent a month on this project. You understand that if there may be though that miscommunication can lend towards, again, missed expectations. Okay. All right, and then next, project measurables. This is a fun one here. So there are 3 kinds of measures, and there's outcome measures, there are process measures, and there are balancing measures. These measures are very, very crucial to understanding your improvement down the road, and also where is your project starting at, right? And we'll talk about other things such as like baseline soon, but think of the outcome measure as your big goal, your SMART goal. This is something that you're trying to achieve ultimately. So for me, you can see my SMART goals right there as my outcome measure, because that was the big thing. I'm trying to improve screening rates, right? I'm trying to make that rate number higher. Up is good. Okay, so if that's the overall thing, then it's like think through, well, what's contributing towards achieving that outcome, and those contributing things are known as process measures. So think of that as for me, I needed to know how many of these kits were returned to the lab. I needed to know, of the ones that were returned to the lab, how many were actually processed. I needed to know, of the ones that were not processed, why. And if there were specific reasons, various categories of why a certain specimen was processed, I want to know that. I want to know if maybe there wasn't enough patient identifiers on the actual test kit to be able to even say, okay, I have the result, but I don't know who the patient is. That's moot point. Unfortunately, we need to toss it. Or maybe there might be a defect with the kit. Maybe we received the kit and it was open and exposed to the elements, and now it's no longer a good sample. So I needed to know that discrete information to then be able to do potential improvement. And then if I do certain improvements, you can see how all these things would contribute towards the larger outcome measure. And then the last one is balancing measure. So balancing measure, for me, it's always that's always been a difficult one, because you're definitely having to think outside the box a little bit. And you're saying, well, if I'm going to start doing improvement, what might I not want to unintentionally impact? And I'll probably add some additional examples. But for me, it was, I want to make sure that I don't accidentally impact the work of lab techs doing other work, important work. And there's some work that's associated with what's called critical values. And these are values that maybe was some sort of, I'm not going to use stat labs and all that, but it was a really important test that needed to be performed immediately. And if there was a poor result, it needed to get conveyed to the clinical staff immediately. I wanted to make sure that I was building a system that allowed for all of this work to happen simultaneously, but not, right? So not deviate, not accidentally say, no, my work is the most important work and it has to be done this way. So whatever else you're doing, don't do. So I of course I'm not going to do that, but I'm also measuring if how well is that other thing going, just in case, because I want to just make sure that I don't accidentally impact. Dennis, you have us a little something?
No, I just think it's a very good point. Very good point.
Okay. All right, let me give you some examples here, and by the way, we'll be talking more about this later on. We'll get some participation. Okay, so again, this is just one more layer of an onion. So outcome measures, high level, clinical or financial or other. What is your SMART goal? Examples we've used before: mortality rates and readmission rates and surgical site infections. One example that we often use, just to kind of say outside of the work environment, is maybe it's me talking about, I think I've spoken about this before, but maybe I want to improve my running, my mile time. Okay, so maybe I want to go from, I don't know how fast I run right now. I haven't done it quite a bit. And so let's just say I'm going sure a nine we'll go 10-minute mile to a 9-minute mile. Great. Dennis, I'm sure you can go faster. So sorry. So let's say I want to go from a 10-minute mile to a 9-minute mile. Okay, so that's my outcome measure, right? Me going faster. And so that's my example. And then I'll move forward to the next slide. So process measures. So process measure the specific steps in a process that lead to a particular outcome metric. So this is right. This is what's going to contribute towards that mile time getting better. And it very well may be, well, I got to make sure that I'm eating healthy, and there's some other things that you can understand that there's some things that I can do to maybe eat more healthy. It could even just be, let me count my calories, or let me see how much water I'm drinking on a daily basis, and measuring how much water I'm drinking. Maybe it's making sure I'm eating the right calories, right? So I'm gonna measure how many bags of chips I'm eating in a given week or month, and my goal is to reduce that, right? So those are all process steps that if I think that reducing less bags of chips per month will help and contribute towards better health and maybe that improved mile time, great, and I'm going to measure that and I'll watch that. So hopefully you're seeing that there's many potential process measures that contribute towards that outcome measure, and so for my mile time, it might be that. I mean, maybe even might be me looking at my shoes and making sure I'm wearing a shoe every time I go running. All right. Okay. And then there's balancing measures. So this one, again, just to speak through, this one is about metrics tracked to ensure an improvement in one area isn't negatively impacting another area. So I have, what would be a good balancing measure for running time? Maybe it might be I'm not maybe overrunning. As you might, maybe some of you know, if you overrun sometimes, or maybe start too fast, you can also injure yourself. So maybe I'm saying, you know what, where I'm at with my running capability, I can run for 20 minutes at a time, and I'm just going to kind of pace myself at that, and that's what I'm going to do for right now. And so I'm going to ensure that I'm going to measure, how am I feeling? Just overall, maybe on a scale of 1 to 10, how am I feeling on a daily basis? If 1 is bad and 10 is good, and I'm at 3 and I'm not feeling great, and then I go ahead and still run and I hurt myself, you know what? That's something that's on me that I measured, I saw, but I didn't learn from, and so I still decided to run. So I'm going to make sure that all these activities I'm doing to get to improve my outcome measure, there's something there around my general health and fitness to be able to produce the outcome measure isn't negatively impacted. Great. I ran through that one. So that's the bulk of this session as it relates towards charters and measures. I think at this time we would love to hear your input. And there was some work that we had talked about last time. And Dennis, you're free to jump in here.
Okay, yeah, okay. So now everyone, if you would do a couple things. So what Roberto just covered, outcome, process, and balance and measures, that's called the family of measures. And he also talked about how to put together a project charter, which is so important because it gives you direction around what to do and how to do it and who's going to do what and when and all that good stuff. And specifically your scope. So you or your sponsor or whoever this will involve, they have an idea and have approved that this is work that they will actually support. So it's very, very important to get that support up front. So now what we would like for you to do, and we have a couple minutes. So this is where it's going to be an in-class activity, and hopefully everybody will participate. So as before, we talked about, and so if everybody would take out a clean sheet of paper or so, or you might already have it. But in your daily work, and we started this before, if you can identify 4 things, and this will be the start of your project, and then we would like to go around the horn. We like to give everybody about like 5 minutes to write them down or type them in your phone or whatever, and then actually put them in the chat. And then what we would like for you to do is actually share out with the class. And those 4 things are, now again, this is, fish off your own dock where you work at for right now. What is an opportunity or problem that you can focus on? Okay, that's the first piece, and synthesize it. The second piece will be, what will be a good outcome measure for that project? The third would be, what are 2 potential process measures for it? And the fourth would be, what would be 1 balancing measure? So problem statement, outcome measure or goal, and those are synonymous with the SMART goal, 2 process measures, and 1 balancing measure. And then also, so that's going to be the homework or in the class work, and it's 12:40 right now. What we would like to do is give everybody 5 minutes maximum. And if you get it finished sooner, just pop it directly into the chat. So as soon as you actually finish yours, type them into the chat, those 4 elements with your name, and then we're going to give you an opportunity to just briefly share out with the class. And then the other thing is we want to share out a little bit too. Nisha was going to wait until the end of the class today, but based on your attendance and completing the course surveys, we will be offering an improvement certificate for everybody who's actually attended all the courses, okay, or all the lunch and learns. So in any event, now is on 12:41, so you have until 12:46 to actually complete those 4 things, and please type them in the chat. And if you have any questions, Roberto, Nisha, and I are actually on the phone at your convenience. And then, Gail, I would like to ask you, how is the AI going? I'm curious. Nisha, you could play some soft music while we wait for others to type theirs into the chat. If you have any soft John Legend or something, but you have good music, Nisha. Yeah, you can pop on just a little music and then we stop it at 12:46. I don't think it's coming through these, so it's okay. It's 12:45 now. We got like one more minute.
You didn't hear any of that?
I just heard some blurbs.
Oh,
It's okay.
we'll try again.
No, it's okay. Okay, ladies and gents, one more minute. Okay, it's showtime. Again, this is just practice. So no pressure. I don't see anything typed in the chat, but we'll go ahead and start. And so what I'm going to do is just go down the little list of names that I can see. Clayton, are you still on, sir?
Yes, sir.
Can you come off and mute? And can you answer the 4 questions?
I didn't have one for work that I could think of.
Yeah, think of something
I'm-
personal. Yeah, anything.
So the opportunity or the problem that I've been having is I have a 3-year-old and he just turned 3, so he's really a 2-year-old. And he doesn't like to go to bed on time.
Perfect.
So currently he's pushing it to like 9:30, and we want to get him to an 8:30 bedtime.
Okay,
Um,
perfect. So what would be, so that's the problem statement. Your 3-year-old doesn't like to go to bed on time. What would be your SMART goal or outcome measure?
so this one I didn't get to.
And you might want to couch it as like today being March, let's say 7th.
Yeah,
By March 31st, my son will be in bed by 8:30, 80% of the time. And
ooh, I
currently
like
he's
that.
in bed by 8:30, 50% of the time. And you might want to reverse that and say, by my son is currently in bed 50% of the time by 8:30 p.m. By March 31st, 2024, he will be in bed by 8:30 p.m. 80% of the time or 90% of the time. And that would be your SMART goal or your outcome statement. And then what would be a couple of processing measures? See,
So
and the
for
processing
these,
measures drive the outcome.
um, we were thinking potentially to reduce his nap time, or I guess that would be the first step, and then potentially eliminating it if we see improvement. So that would be
Mhm.
one to keep
Uh-huh.
an eye on and measure the results as it goes. And
Perfect.
then the second one was um, sort of similarly um, adjusting the quiet time before bed so that it helps ease him into it. And then same thing, measure that as we go and adjust accordingly.
Perfect. Perfect. And what would be a good balancing measure? Unintended consequences.
He wakes up earlier.
He wakes up in the middle of the night all the time.
Yeah, or wakes us up at 4 and doesn't want to go back to bed.
Yeah. What's his name, Clayton?
His name's Alexander.
Alexander. Oh, that's adorable. Okay, super. Thank you. Thank you for sharing. Okay, let's do one more. I say Paulo. If you're still with us.
Oops, sorry, I had to unmute myself. Yes. Hi there. Yeah. So thank you. I was struggling initially with how to even make sense of it because I know there was a distinction between just regular operations and having a performance improvement project and having a charter for that. So I was trying to adapt it as if we were creating a project charter for something that we're trying to do operationally.
That's a
So
really
I
good
guess,
question. That's a really good question.
yeah.
So it can be something that you have to do every day operationally, but if you're not hitting target, or if you want to do it better, you just say, let me just think about this. How would this be as a little project?
Mm-hmm.
Ideally, it is operations. It's what you do daily, and you want to do it maybe a little better.
Mm-hmm. Mm-hmm. That's right. That's right.
So what would your example be, sir?
So my example, I'm with the Behavioral Health Access Line, and so I wanted to get something really concrete. And so one of our actual quality improvement goals is to decrease our abandonment rate. So the number of callers that end up, hanging up or ending the call because they feel they're waiting too long. Mm-hmm. And so I guess, so the problem would be how to increase access to behavioral health services for all callers seeking help. Mm-hmm. And let's just say like our baseline is like 8% abandonment rate. And so our SMART goal would be decrease the abandonment rate from 8% to 6% by the start of the next calendar year.
Okay. Perfect.
And so I'm struggling a little bit about the activities because there's so many that goes into why people end up hanging up. So, sometimes it's not having enough staffing. It's, having, just dealing with this.
So you might want to think about, it's two pieces. You want to go in and
Mhm.
do some root cause analysis to find out, like the why people are, balking out of the system. But you might start with a couple process measures around, like, say, average wait time or something. So do they abandon immediately, or do they abandon after they waited for a minute or so? So you might want to just think about, what would be something that might drive abandon rate? Waiting too long? What else? And that might be one to start with. And then the other one for the balancing measure might be, say, average speed of answer is like really good, but a balancing measure might be what? They call back multiple times or so, same caller calling back multiple times because they can't get in the queue. So they hung up and abandoned the first time, and they just keep calling back. And so somebody's tied up the whole time with repeat calls.
Yeah. I'm still trying to understand the difference between a process measure and a balancing measure.
Yeah. Process, it
but,
goes into the process. Balancing is unintended consequences. Unintended
okay.
consequences, which could be bad. Like Clayton kind of said, okay, hey, my Alexander, he wakes up, like 2:00 in the morning every morning. So that's probably not good if we put him to bed early, because now, mom and dad are waking up too. But in your particular case, unintended consequences might be behavioral health, they don't get served. And they don't get the necessary care or treatment that they should have, and other things occur with them. So, by not getting through, it presents a larger problem for the patient or and for the care team, because when they do get in, they might be a little worse. But those are the things to think about. And then actually, like Roberto said, if you spend any time with the people who are abandoning, or if that rate is really high, maybe even ask the team, why do you think people are abandoning so frequently? And, what are some of the things that's part of the process that we need to measure and look at?
I see.
Okay. But good.
Yeah, thank you. I was taking notes and all that. Yeah, I appreciate that.
Let's do one more. Let's say, let's say Nicole.
Hello, can you hear me?
Yes, Nicole, we can hear you. Good afternoon. How are you doing?
Good afternoon. I'm doing well. Here, I'll turn on my video to you.
Great. Well, that's an honor.
So I also kind of struggled to come up with something work related, so I came up with something at home.
Yeah, that's perfect.
So I said by June 21st, I'm going to, so the issue is that one of the rooms in my house, actually more than one, but I'm just focusing on one, has a lot of clutter in it. And so I'm going to say that by June 21st, everything in the room that is going to be staying in the room will have a home, and it will be easy to put things away when I use them or get them out. So the process measures are more space in the room, and that items are coming out of the room. So for donation or getting thrown away or whatever. And my balancing measure was that I will not be creating clutter in other rooms of my house.
That's a good one.
Yeah, very good.
That's a really good one.
So that's what I got.
Great. No, that's great. That's perfect. We have to make this stuff as practical as possible.
That's right.
So last one, Melanie.
Hi. So for my problem statement, my issue right now is I injured my knee, and so I am not able to play volleyball since January 6th of this year. And so a smart goal of mine is hopefully by August of 2024, I want to be able to play volleyball with at least 95% mobility and stability.
Excellent.
I'm having a little issue with the measures. So outcome measures,
So that would be your outcome measure. So let's just say
Oh, I
your
see. Okay.
mobility, Your mobility right now is to play volleyball, let's just say 60%, you want to get to 95%.
Oh, okay. So give a baseline to a
Yes.
goal. I see.
Yes,
Okay.
yeah, so you can say, did you improve from that baseline, yay, nay?
Oh, okay.
Mhm.
Okay. Gotcha. Okay. So then my outcome measure would be at least 95%
Yes,
mobility and stability. Gotcha. Then the
uh-huh,
process measures, then I would maybe like count the rate of PT exercises I'm doing per day.
correct. Yeah, I would actually say you, again, I'm making this up, but you
Right.
spend, did PT 4 times, you do PT 4 times a week for 60 minutes. And then you're
Oh,
actually also doing some light weightlifting or so for X times. And then that's what you're going to measure. So you're going to measure, did you do your PT 4 times a week, yay, nay? And did you stay in there for 60 minutes, yay, nay?
oh, okay.
Mhm.
Gotcha. Okay. Thank
And,
you. That was really helpful.
and then the balancing measure might be, let's just say you're working too hard because you're such a great athlete and gung-ho about it, that you re-injure the other knee or so because you put too much pressure on the knee that you're trying to actually get better.
Gotcha. The risk of having that re-injury on the same
Yes.
knee. Got it. Okay.
Re-injury on the same knee and or putting more pressure on the
On the
good
other
knee.
knee. Uh-huh.
Right, right. Mhm.
That you're overcompensating. Okay. Got
Yes,
it.
yeah,
Got it.
overcompensating. Mhm.
Mhm. Okay.
Okay.
Thank you.
So those are all good, and it's say 12:59. And so Nisha, if you would actually share, we're going to continue on with the journey. So we have 8 more classes, and as we go into it, what we're trying to do is just get you the concepts. But what we really want to do is, this is the process. What's wrong with it? What are the pain points, frustrations, and how do you fix it? And that's where we're going with this. So Nisha, if you actually share what's in the chat there.
Hi, everyone. So I just posted the session evaluation, and I'll continue to do so as we get towards the end of each session. And just as Dennis mentioned, so we're now planning to offer those certificates of completion to those who, moving forward, continue to show up to the Improvement Academy sessions and also fill out the evaluations. At the bottom, you'll see that there is most of the evals are anonymous. But for those of you who wish to receive a certificate, we have to track your name. And so it's not required for other folks, but you do have to put your name in so that way we know who to provide the certificates to. And then those will be presented to you all and mailed out at the end of the Improvement Academy.
And we also, the real deal is we want to get your feedback so we can actually help deliver value and help you think through. See, the goal of this program, per Anna Roth, is really, she would like to see, how many people work in the county? Say Roberto or Anisha?
Just
Like
in
about
general,
5,000?
a little over 5.
Oh,
Little over 5K, right?
Yeah.
So Anna's and Erica goal is actually to create over 5,000 problem solvers capable of solving problems at any level over time and having the fundamentals. And so she's really kind of like gung-ho on, okay, hey, how can all my team be engaged and everybody be excited about coming to work? And if anything is wrong in their daily work, they have the tools, the authority, and the power to actually fix it. So that's where we're trying to go with this. So all feedback that you have will be good. And what we want to do is just help you get there and actually realize some of your personal passions and goals as well too. Okay. So if anybody has any questions, please let us know, or please put it in the surveys. And we really just appreciate you taking your time. And more importantly, if you actually put in there, what would you actually like, or problems that you're trying to solve, so we can actually spend more time. And like Roberto or Nisha or myself, we're more than happy to actually do some one-on-ones in addition to this time, to actually really help you complete some of the work that's currently on your plate, because you do a great job every single day. And I'll sip it right there. And Roberto or Anisha, if you have anything to say, because we're a little over time.
nothing else from me. Just once again, just sharing appreciation for everyone showing up and participating. So looking forward to seeing you all next time.
And next time we might have a guest speaker. We have the elegant Eva Marie Bella on the line. So she might actually share her project and actually give you some ahas around all the good things that she's learning and she's doing in her leadership track. Is that okay with you, Eva Marie? I didn't ask you beforehand, but said no, thank you. But anyway, everybody take care. Have a great rest of the afternoon, and we'll see you in a couple of weeks. Bye now.
Thank you.